The way that this dual array technology provides improved spinal needle interventions from a technical perspective is that the arrays are positioned slightly off from each other around the center of the midline, and this lets us kind of angle into the spinal anatomy. That means that we avoid some of the interfering structures that would otherwise degrade the image. We can get a really clear view of the landmarks in the image that are important for guiding the procedure. And then, just as importantly, we can kind of place a gap in the middle that allows us to approach that anatomy with a needle more directly. The other side of this that's really interesting is instead of just looking at the anatomy and getting a clearer image of that, we're also able to look at the needle itself in a unique way. We have two different arrays looking inward at the needle, which is not typical of a conventional probe. This means we get two votes or two looks at where the needle is. We can track it differently through the tissue. We can get much higher confidence of where it is and where it's going. The total package here is a really compelling one that we basically have AI guidance to make the image clearer to the person reading the image. We have a unique probe form factor that makes it more intuitive to place the needle, but also the technology in the probe itself makes it easier to detect the needle and to track it in the first place. So all that together builds just much more confidence in the procedure as a result of the technology.